So I was asked to talk about my experience of leadership within the advanced practice pathway. I'd just like to apologise for not being able to attend today. I'm in the middle of night shifts at the time of the conference, so I was asked to pre-record this presentation. My name's Emily, and I'm currently in Year 3 of the ACP Masters in Bangor University. I currently work within the Acute Intervention Team, or Critical Care Outreach Team in Ysbyty Gwynedd in North Wales. I transferred to this job around 5 months ago after starting my ACP pathway within a stroke service as a lead stroke specialist nurse. While my current job is largely clinical, my previous role was a mix of clinical and management, as I had to manage a small team of specialist nurses. Although leadership doesn't have an isolated module within the ACP pathway, my experiences throughout the course have allowed me to progress from thinking like a manager, as I was doing previously, to acting and thinking more like a clinical leader, and it changes the way in which I think and practice. The course has led me to recognise that leadership goes beyond management or managing care, but strong clinical leadership enhances patient care by encouraging collaborative workings. Through completing the clinical hours within the prescribing module, for example, I developed relationships with colleagues from the multidisciplinary team. And collaborating with these other professions has improved communications and encouraged teamwork and more comprehensive decision-making. At the time, it was central to identifying and implementing improvement projects within the stroke service. For example, the stroke pharmacist and I worked closely together to coordinate changes to the stroke thrombolysis pathway, and then eventually we managed to change the pathway to include a new thrombolysis drug. I don't think there's enough emphasis on this pillar, particularly within practice. I completed a leadership module alongside the course. In my health board, these courses tend to be reserved for managers, and if I wasn't in a management role at the time, I don't think I would have had access to this course. For part of this presentation, I was asked whether I think that managers appreciate that ACPs should be allocated 80% of their time to the clinical pillar and 20% to the other 3 pillars. And my answer is that it depends on the manager. In my previous job, my manager was supportive throughout the course, but she lacked understanding surrounding advanced practice and didn't really understand the 4 pillars at all. I was given time to fulfil my management duties, but this was purely because I was in a management role and not because it was anything to do with the leadership module or the leadership pillar. My current manager has a much greater awareness of advanced practice. I have to ask for time to be allocated to different pillars, but usually it's granted if workload allows for it. She's got experience within managing ACPs before and comes from a recently clinical background, so I think that definitely helps. I have no doubt that the connections that I've built and the skills that I've learned throughout the ACP modules have developed my clinical leadership, and I hope to keep using these connections to encourage more collaborative working within the future. I'm grateful for the opportunity to speak today. This presentation has encouraged me to think a lot about leadership, about why it's important and how I use it within practice, and also to reflect on how I'll continue to fulfill this pillar in the future. Thank you for listening.